everybody, I'm Dr. Jordan Taylor, the Undergraduate Exercise Science Program Director and Associate Teaching Professor at the University of Kansas. The barbell back squat is arguably one of the best exercises for the lower body. This is because squats are one of the most functional exercises to perform. Think about how much you squat throughout your everyday life. Getting up and down from a chair, couch, bed, or toilet are several examples. Performing this lift is common in the training programs of fitness enthusiasts, bodybuilders, powerlifters, Olympic lifters, and athletes in sports that require large amounts of lower body force production and power. The barbell back squat is a lift that pretty much everyone should include in their training program, unless there are specific musculoskeletal conditions or injuries that would lead to this lift being contraindicated. The barbell back squat strengthens every major muscle in the lower body. It's essential to create whole body tension to make sure that you complete squats with good form. So, core stability is required to complete the lift with proper technique, which reduces the risk of injury and loads the targeted muscles in an appropriate manner. The core musculature is strengthened because you have to brace your abdominal muscles and contract your lower back muscles isometrically to keep your spine supported and torso in the optimal position during execution of the lift. When I say optimal position, you must maintain the barbell over and directly in line with the middle of each foot to maintain balance throughout the lift. If the barbell moves too far in front of or behind the middle of each foot, then your center of gravity will shift outside of your base of support. As a result, your form will break down and you risk injury and may even fall forward or backward. The barbell back squat is great for strengthening muscles involved in hip extension and knee extension. Adding 3 to 5 sets of squats into your resistance training program 1 to 2 times per week will help develop the muscle mass and strength necessary for improving athletic performance and the ability to complete activities of daily living with greater ease. In this video, I will discuss the major muscles that the barbell back squat trains. I will also explain how different factors such as your bony anatomy, mobility, and even the type of shoes you wear can all affect your squat setup and technique. Instructions will be provided so you can learn how to safely perform this lift with proper technique, and common errors made during execution of the lift will also be described. The barbell back squat will also be demonstrated in this video. So the major lower body muscles involved in executing the barbell back squat include the gluteus maximus, semimembranosus, semitendinosus, biceps femoris, vastus lateralis, vastus intermedius, vastus medialis, and rectus femoris. So what factors affect your squat setup and technique? Some people tend to squat with a more vertical torso, while others squat with a more forward-leaning torso. Both forms are safe as long as the spine is maintained in a neutral position and the barbell remains positioned directly over the middle of each foot during the lift. Factors that can lead to a more vertical torso while executing barbell back squats include a shorter relative femur length and longer relative torso length. Lifters with a shorter femur and longer torso will be able to maintain a more upright posture throughout the lift while still keeping the bar balanced directly over the middle of the foot. A higher bar position on the back allows the torso to be more upright while keeping the bar balanced over the middle of the foot. This bar position decreases the moment arm between the hip and the bar and increases the moment arm between the knee and the bar. As a result of these moment arm links, this higher bar position increases the external torque applied at the knee while decreasing the external torque applied at the hip. Therefore, the lifter must rely more on the quadriceps muscle group and less on the gluteus maximus and hamstrings to generate the force necessary to overcome the external torques and complete the lift. A wider stance width allows for a more upright torso and generally feels more comfortable for people with retroversion of the femoral neck and/or acetabulum. Retroversion of the femoral neck occurs when a person's femoral neck is rotated backward compared to the shaft of the femur. Retroversion of the acetabulum is another variation in hip joint anatomy seen when the hip socket is facing more backward than forward. Both forms of retroversion allow for greater hip external rotation and therefore a wider stance width that feels more comfortable. Greater ankle dorsiflexion mobility is required to complete squats with a more vertical torso. And wearing weightlifting shoes with greater heel elevation, weightlifting shoes also allow the lifter to squat to a given depth with a more upright trunk due to decreased demand for ankle dorsiflexion, which allows for increased knee flexion. Greater relative quadriceps strength. Individuals with extremely strong quadriceps and weaker gluteus maximus and hamstrings will likely prefer squatting with a higher bar placement on the back and a more vertical torso. Also, if you want to specifically target the quadriceps muscles more during the lift, then squat with a high bar placement and more upright torso. Now, what are the factors that can lead to a more forward-leaning torso while executing barbell squats? These include a longer relative femur length and shorter relative torso length. Lifters with a longer femur and shorter torso will have to squat with the torso leaning more forward to keep the bar balanced directly over the middle of the foot. A lower bar position on the back necessitates the torso being pitched more forward throughout the lift to keep the bar balanced over the middle of the foot. This bar position increases the moment arm between the hip and the bar and decreases the moment arm between the knee and the bar. As a result of these moment arm lengths, the lower bar position decreases the external torque applied at the knee while increasing the external torque applied at the hip. Therefore, the lifter must rely more on the gluteus maximus and hamstrings and less on the quadriceps muscle group to generate the force necessary to overcome the external torques and complete the lift. Next, a narrower stance width allows for a more forward-leaning torso and generally feels more comfortable for people with anteversion of the femoral neck and/or acetabulum. Anteversion of the femoral neck occurs when a person's femoral neck is rotated forward compared to the shaft of the femur. Anteversion of the acetabulum is another variation in hip joint anatomy seen when the hip socket is facing more forward than backward. Both forms of anteversion allow for greater hip internal rotation and therefore a narrower stance width that feels more comfortable. Restricted ankle dorsiflexion mobility may necessitate squatting with a torso that is leaning more forward. Also, wearing shoes with no heel elevation, such as Chuck Taylors, allow for squatting with a less upright and more forward-leaning torso. And having greater relative gluteus maximus strength, individuals with extremely strong glutes and hamstrings, they will likely prefer squatting with a low bar placement on the back and a torso that leans forward throughout the lift. Also, if you want to specifically target the gluteus maximus and hamstrings more during the lift, then squat with a low bar placement and more forward-leaning torso. Now let's discuss proper barbell back squat technique. Execution of the barbell back squat can be explained in 3 phases: the beginning position, downward movement phase, and upward movement phase. So beginning position. Grasp the bar with a closed pronated grip. The width depends on the bar position. Step under the bar and position the feet parallel to each other. Place the bar in a balanced position on the upper back and shoulders in one of 2 locations. In the low bar position, the bar is placed across the posterior deltoids at the middle of the trapezius using a hand grip wider than shoulder width. In the high bar position, the bar is placed above the posterior deltoids at the base of the neck using a hand grip only slightly wider than shoulder width. Lift the elbows up to create a shelf for the bar using the upper back and shoulder muscles. Hold the chest up and out. Retract the scapulae or shoulder blades toward each other. Tilt the head slightly up and look forward. Extend the hips and knees to lift the bar off the supports. Take 1 or 2 steps backward. Position the feet shoulder width apart or wider depending on comfort, and keep the feet even with each other with the toes pointed slightly outward. All subsequent repetitions begin from this position. Now to the downward movement phase. Allow the hips and knees to slowly flex while keeping the torso to floor angle relatively constant. Maintain a position with the spine neutral, back flat, elbows high, and the chest up and out. Keep the heels on the floor and the knees aligned over the feet. Do not flex the torso or round the back. Continue flexing the hips and knees until the thighs are parallel or slightly below parallel to the floor. You can also squat deeper to full depth if you so choose, as long as the increased range of motion does not cause any pain in the lumbar spine, hips, knees, or ankles. Do not accelerate the bar or relax the torso at the bottom of the movement. Last is upward movement phase. So extend the hips and knees at the same rate to keep the torso to floor angle constant. Maintain a position with the spine neutral and back flat, elbows high, and the chest up and out. Keep the heels on the floor and the knees aligned over the feet. Do not flex the torso or round the back. Continue extending the hips and knees to reach the beginning position. After the set is completed, step forward toward the rack, squat down until the bar rests on the supports. So what are the common errors that are made during execution of the barbell back squat? These include not getting enough range of motion and not lowering the thighs parallel to the floor, allowing the back to round or flex, not performing a Valsalva maneuver and bracing to increase torso rigidity and stabilize the spine, not controlling the eccentric downward phase of the movement, the heels coming off the floor, allowing the knees to collapse inward, not extending the hips and knees at the same rate to keep the torso to floor angle constant.
So before we get into the barbell back squat technique demonstration, brought in one of my former students, Kayla Hoover. She graduated with her Bachelor of Science in Exercise Science degree from KU. She's also I had to make sure it was NASM and not NSCA, a National Academy of Sports Medicine Certified Personal Trainer. And she also completed her Strength and Conditioning Certificate here at KU. So thanks for coming in.
Thank you for having me.
And tell us why you chose to major in exercise science and what you're now doing in your career since you graduated from KU.
So completely different from what I went into. So initially I wanted to go into physical therapy, and the farther I got into it, I kind of realized that these people were going into physical therapy with like a lack of like mobility, flexibility, and strength, and that's why they ended up in PT. And I was like, there's got to be a way to get ahead of these people beforehand. So then I got into strength and conditioning, and I kind of wanted to weave more into the athletic side of things.
So basically what you're saying, and this is a good point, like with strength and conditioning personal training, you can think of it as a form of prehabilitation so that you don't end up in rehabilitation, right? And so that's one of the major problems I think in America is like everybody's reactive instead of proactive. So they eat like crap, they don't exercise, and they get sick, and then it's like, okay, we need to fix it with pharmaceuticals or changing our lifestyle, when you never would have ended up in that position to begin with if you were more proactive and kind of took control of your health and lifestyle on the front end instead of the back end, right?
Yep.
So then what type of clients do you typically train, and is there a specific population you really enjoy working with?
Yeah, so I wanted to keep it a little more middle school, high school. That way we kind of demolished like gym anxieties early on kind of thing. But as I started training their kids, their parents wanted to come in, realized how out of shape they were. They wanted to get back into shape and kind of prevent those things from happening as they got older, because I expressed to them like, you'll be picking things up off the ground your whole life. Like you should be practicing these things.
And then again, where are you training out of, just so everybody knows?
So I'm at a gym in South Olathe, Primal Fit Lab off 151st in like I-35 area, right off that intersection there.
Okay. Next question is, what's the most rewarding, and I'm smiling because I've been a trainer and strength coach before, what's the most rewarding part of your job? And I really smile. And also what's the most difficult or frustrating part?
They kind of go hand in hand. So frustrating is when I feel like they don't believe in themselves that they can actually do it and get it done. And if they put like their head to it, like it's doable. Like losing weight or building weight, it's a doable thing. And I think it's the most rewarding watching them realize that they can if they've reached these goals in the end.
And I think too, I know for me, one of the most frustrating things was, and I'm sure you see this with your clients, is like, you've got them rolling, maybe they've been with you for 6-8 weeks, training consistently, and then they start to become very inconsistent, not showing up, and then they wonder, well, why am I not making any progress? Well, because, you know, in my opinion, consistency is obviously the main key. Yeah,
Big
so
time. Yep.
that was my frustrating.
Yeah.
I remember when I was training, my frustrating part. So what types of training do you most frequently incorporate into your clients' programs?
Lots of weightlifting, and then when it comes to like specialized, like in soccer, it's lots of unilateral movements and things. So it's a combination of weights and then specific training depending on the position that my athlete would be in.
Makes sense. Good principles to follow. And then how can people contact you for training?
Yeah, so you can either reach out through social media, my Instagram, it is Keep Fit Real, or you can contact me through my email, and that's kaylahoo42@gmail.com.
All right, so you ready to get into this barbell back squat demo?
Yeah.
All right.
Let's do it.
All right, so with squat technique, I'm going to break this down into 3 phases, right? Kind of the beginning position, a downward movement phase, and an upward movement phase. So let's talk about each phase so that you can perform it with proper mechanics, all right? So Kayla's gonna approach the bar here in the rack. We got it at about, the height of her shoulders, all right? So let's talk about grip width and bar placement, where to place the bar on your back, right? You'll hear people say you gotta do low bar squats or high bar squats. Some of this depends on your bony anatomy, where you prefer having the bar at, and also flexibility through the hips, through the ankles. So you can see how here Kayla's set up. So she's got a grip width, right, of just a little bit wider than her shoulders, all right? Now, she's kind of in between a low bar squatter, which a low bar squatter is going to have it right across the posterior deltoids, and a high bar squatter, which it's up higher across kind of the upper trapezius, okay? So she's kind of in the middle, right? So let's give an example of what a low bar squatter would look like. So move it down. Now your hands would tend to go out wider. If you're a low bar squatter, see how she's got it lower across the posterior deltoids now? Hand grip width is wider. That would be the setup for the bar placement if you're doing low bar squats. Now, you can rest a second, back out. All right, why might you prefer low bar squats or high bar squats? Well, a high bar squatter typically has shorter femurs relative to their torso. So they've got short femurs and a long torso. So that allows them, when they squat and descend down, to stay more upright with less forward inclination of the torso. And they're still able, in that upright position, to keep the bar balanced over the midfoot, right? So if you look at somebody from the side and that bar is on the back, throughout the entire lift, that barbell has to stay positioned directly over the middle of the foot so that you're balanced. You know, if you start squatting and tip too far forward or too far backward, your center of gravity is going to fall outside of your base of support. When your center of gravity falls outside of your base of support, that's when you're off balance and injuries could happen, right? So again, no matter where you squat with the bar on your back, whether it's low or high, it has to be maintained over the middle of your foot throughout the lift. So if you're a low bar squatter then, in contrast to high bar, low bar squatters, typically they're going to have a long femur and a shorter torso. So they really have to, when they squat down, pitch and hinge more at the hips and lean their torso forward more, right? So again, they're squatting down and they're really leaning more forward, okay? So that's with a low bar squat. All right, so that's your setup. Now go ahead, approach the bar, get back in there, do your ritual, get in a good position wherever you want to be, wherever you feel comfortable. So now we're going to unrack it, take 1 or 2 steps back, good position. Got the support bars here in case she would bomb out, even though she's not going to do that she squats a lot, she's not going to do that with the bar. But let's talk about the initiation of the downward movement phase, right? You do not initiate this at the knee, right? The hips should flex and sit your butt back first, right? Boom, just like that. Just show that part. That's all, just the unhinging, right? So butt sits back, she's flexing at the hips, and then flexing at the knees, all right? So squat depth now, okay? Where do you like to squat? Do you like to go to full depth? Do you go to the thigh parallel to the floor? Do you go to just...
A little bit below.
So she's a little below parallel. You can go ahead and rack it a second. I'm going to do some more talking. So this is another common question people ask is squat depth. How deep should I go? Well, some of this may be due to flexibility, range of motion limitations. You may have some issues that you're trying to work around there. It's not a one-size-fits-all approach, okay? So let's say it's a power lifter, right? If someone competes in powerlifting, for it to be a legal lift, the top portion, basically right here where the inguinal crease is, the top of the thigh, has to drop to just below the knee, right? So just below parallel. The thigh's got to be just below parallel to the floor. That's a legal lift, right? So you would want to train to that depth if you're a power lifter. Now, generally speaking, I'm a big fan of full range of motion for most people. If you have the ability to descend down in that downward movement phase to a fully squatted position, some people call it, ass to grass, or getting the butt on your calves, squat as low as possible. Now, to squat that low, you've got to have adequate mobility through the hips. You've got to have adequate ankle dorsiflexion, right? So that's where, as you descend down, there's going to be a more acute angle between, especially if you're a high bar squatter, there's going to be a more acute angle between the shin and the top of the foot. So you've got to have adequate ankle mobility to be able to really descend all the way down in a squat, okay? So again, just show the downward movement phase one more time. Again, bar's got to be in line with the middle of the foot throughout the lift. So we're flexing at the knees, getting the butt back, right? And you can see how she's a deep squatter, right? But she's got good mobility. You want to look at the heels, make sure they're not coming off the floor, okay? So again, just drop down one more time. You can see her foot position. This is another important point. She's slightly wider than hip width, about shoulder width, right? And she's slightly externally rotated. So she's got her toes pointed slightly away. So that's a good squat form. Okay, do one more. And then we'll rack it and I'll do a little more talking. So one more, back up and rack. All right. Foot position, right? If you have a more retroverted femur or retroverted hip socket, meaning if the femur head is more twisted back or the hip socket is directed posteriorly backward, you're going to feel more comfortable with a wider, more externally rotated squat stance, okay? You're going to have more external rotation, you're going to feel more comfortable. If you have an anteverted femoral neck where it's pointed forward, or the acetabulum, the hip socket is pointed forward, you're going to feel more comfortable with a little bit narrower stance and the toes maybe not externally rotated as much, maybe even pointing straight ahead, okay? So when you hear somebody say, oh, how many times have you heard this? You got to squat like this. You've got to have this width and your toes pointed this direction. Well, a lot of it depends on structural anatomy, which you can't change that. Functional issues you can change, right? If it's a mobility issue, flexibility, you can work on that, right? And I'm sure you work on that a lot with your clients.
Even me.
So that can be worked on. But if it's hip anatomy, we can't change that, right? So don't be too hard on your clients, athletes, whoever you're working with on the squat stance. They've got to find something that's comfortable and works for them. All right. Upward movement phase now. So we'd be starting at the bottom, but we'll start at the bottom. All right, so we went over the downward movement phase. So when you're coming up out of the hole, right, obviously you want to focus on extending at the hips and knees. And as you approach the top, really squeeze with the glutes and try to push those hips forward, okay, to lock it out, all right? So again, start at the bottom. As we extend with the hips and knees, what muscles are we working here? Well, gluteus maximus, because that's moving us into hip extension. Quadriceps muscle group is moving us into knee extension, all right? And another thing to think about, you can rack it. Okay. And then we're going to show the full squat, okay? Just a couple full reps. Valsalva maneuver, right? Mm-hmm. So if you start lifting heavier loads, because the squat is a structural exercise, it's loading the spine, to help stabilize the spine, what you can do is perform a Valsalva maneuver. So this is where you take a deep inhalation, you brace the abdominals, right? So you're going to contract the abs, and you basically think about exhaling against a closed glottis, right? So the glottis is the opening there in your larynx at the top of your trachea. So you're basically trapping air in the lungs, increasing intra-abdominal pressure by tightening the abs, and that's going to help, again, taking that big inhalation and holding that's going to help stabilize your spine throughout the lift. All right, so that, again, you need that kind of whole body tension when you really start working with heavier loads. Now, there's one demographic I would not do the Valsalva maneuver with, and that's people with cardiovascular issues, right? So if they have any heart conditions, high blood pressure, do not have them perform a Valsalva maneuver. Make sure they're doing a weight where they, inhale on the way down, a lighter load, and exhale on the way up, okay? Because, again, if you do a Valsalva maneuver and you already have high blood pressure and some cardiovascular issues, that can really spike your blood pressure even higher. We don't need any brain aneurysms happening. We don't need to, a Valsalva maneuver can also decrease temporarily some venous return to the heart. But if you're a healthy lifter and you're working with heavier loads, you need to do the Valsalva maneuver. You do Valsalva maneuver?
Rarely.
Rarely? Well, you need to lift heavier. No, but yeah, you understand when it's necessary, right? So, because again, just keeping that spine stable. You don't want any lumbar spine injuries, right? No disc herniations at L2, L4, L5. We don't want any of that happening. So that Valsalva maneuver helps stabilize. All right, so let's show a couple full squats now. Let's see what the whole thing, put all the phases together. So again, good position. She's kind of in between a low bar squatter and a high bar squatter. I'd almost say, yeah, you're closer to high bar. So again, squatting down. It's okay for the knees to go slightly over the toes too. You always hear people say, oh, knees can't go over the toes. Yes, they can. She's got adequate ankle dorsiflexion mobility and good flexibility through her calves down here, her gastroc and soleus. So again, she's able to squat with a little bit higher bar, all right? Bar placement on her back. Typically, if you have poor mobility through the ankle, you squat with a lower bar position and you pitch forward more at the hips and the shin stays more vertical, all right? We're gonna do a few more full squats here since we went through all the movement phases, so go ahead and demonstrate a few. The last thing you wanna be aware of, which is very important, is keeping the chest up and the back nice and flat and in a neutral position, all right? And some people may have a little butt wink at the bottom, and that's okay where the pelvis rotates under them, as long as the lumbar spine is staying flat, which hers is, okay? So a little bit of butt wink's okay. Now, if you would butt wink and then flex at the lumbar spine and round, that's not good. That's gonna put a lot of stress on those discs in the lumbar spine, and you're gonna be at risk of a herniated disc, okay? Or a erector spinae strain or something like that. So again, chest up, back flat, and little butt wink's okay as long as the spine is staying neutral and flat. Some people are going to have preferences, and it's all okay as long as they have good mechanics and they're not putting their body in a position where they're going to be likely to get injured, okay? Thanks for coming in.
You're welcome. Thanks for having me.
Yeah.
I hope this fitness facts video helped you understand the barbell back squat. Thanks for watching.